Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Hey, welcome back to Between the Sheets. I am excited today. We have the CEO of FirmTech with us, Dr. Elliot Justin. He is going to help us talk through erectile dysfunction and the tools that his company has to help our men with this. So welcome.
Great to be here.
Yeah, I'm excited. So tell me how FirmTech came to be to start with.
You want the deep roots, or
The
you want
little Cliff Notes version.
Okay. I'll skip over. No, so basically, about 3 years ago, a urology professor at the University of Utah challenged me coming up with a way of counting the number of nocturnal erections that a man has. So
Okay.
by background, I'm emerged as a physician. I'm also a medical technologist and a specialist in remote patient management technologies.
Okay. Very interesting.
When he said it to me, I thought, why do we care? I mean, we know about morning wood, but why do we care? We laugh about it, but why do we care about nocturnal erections?
Yeah.
And he explained to me and showed me research showing that the number of nocturnal erections a man has is a leading indicator that man's cardiovascular health. Well, that's powerful.
Yeah,
because
that
would be like a sixth vital sign, and certainly one that's a lot more interesting to men than their blood pressure.
Yeah.
Or how many.
You guys love your penises.
We do. Well, it would essentially give us the vital signs of our most vital organ, and as
right.
you know, we're only as good as our last two orgasms mentally.
Yeah.
So but he, like most doctors, is what I call a cock ring virgin.
Yeah.
I'm fortunate to be married to someone who's into sex toys. And by the way, if anyone of your listeners are considering getting married, that should be an important question to ask. Do you like sex toys? Because I don't think you should marry someone who's not interested in sex toys.
Yeah.
I'm glad you're admitting that. We should be marriage counselors then.
Right. So, a little side hustle.
Yeah. So he wasn't thinking about that. And my thought was, well, let's just not count nocturnals. So let's go for all erections. What do men care more about? The ones they have when they're sleeping? I call it the night shift. Yeah. Or the ones or the ones they have while they're having sex. Those are the ones that most concern them. And the way to do that is to embed sensors into a cock ring. Now, the challenge was most cock rings are these O-rings made out of silicone. They pinch, they're uncomfortable, they cut off the arterial circulation. Yeah. They made the same stupid way for the last 150 years. I wanted to come up with something that could be comfortable to be worn overnight, but would also be an effective cock ring as a pleasure enhancer during sex. Yeah. And so I was thinking about this and scratching my wife's back, which is kind of after she takes off a bra. I think that's foreplay in a lot of households. What do you think, Stephanie?
That is foreplay. Yeah, absolutely. Yeah. I got a back rub last night.
Yeah. And why is that? Especially in the summer, because silicone is irritating to the skin. Yeah. Silicone as a material makes you adapt to it. And my wife on her desk had a stress ball and thought, wow, why don't we make cock rings out of stress balls? Yeah. Because it's a softer material. Because elastomers adapt to us rather than making us adapt to them. Okay. And then the other reality, I'll show you what a ring looks like. Hold on. Then the other thought was inspired by. You recognize this feature here?
Yes, that's the hook.
That's the hook, and women hook bras. Women don't put on bras over their head. Bras are a ring that opens and closes the hook. And I thought, why are we making cock rings out of these things after these pulled, stretched, and pulled on? Yeah. Why don't we make a cock ring that opens and closes with a hook so it's easy on, easy off, especially for men who are overweight. Many men are. I mean, I'm 70. I'll be 72 next week. I can look down and see my penis. I am wearing pants right now, but
thank goodness.
Most men my age look down, they see belly. Most men your age look down, they see belly, and these O-rings can be more of a challenge. So our goal was to get data about the vital signs of the health of penis, but along the way we solved the cock ring problem and made the cock ring a significant enhancer of men's pleasure.
Yeah.
not equivalent to a vibrator, enhanced for man's pleasure.
Yeah, absolutely. I love it. And you guys, thank you for sending me some so that I can show people as well. And I have really liked the technology behind it. And I have told my boyfriend that he will be wearing it so that I can play with the app and see all the information. I
But
think he's a little nervous about being my guinea pig sometimes, I think, but he plays along very well. So I'm really excited about this. So tell me what are we really looking at when the technology connects Bluetooth to an app and
correct.
tells men how many nocturnal erections they're getting, the quality of them? What is it telling them?
Sure. Well, we're in the Google and Apple stores. We've
Okay.
documented 57, almost 58,000 erections right now. We
Wow.
have the world's largest database of men's sexual health. The current recommendations, protocols for the treatment of erectile dysfunction are based on research in the 1990s on
Hmm.
350 men. We've
Yeah.
learned so much more about what's really going on. Uh, and I want to emphasize one thing. The data that we're giving men is objective, it's actionable, but it's also personal. So one of
Hmm.
the mistakes that we doctors make, for men and for women,
Hmm.
is we treat everyone as if they're one size fits all. We have a data
Yeah.
set, and then we treat them the same way. You and I, Stephanie, are obviously different genders, different ages.
Yep.
But if we went to a doctor with high blood pressure, they would put us on the same pill. If
Yep.
we went to a doctor and said we were depressed, they put us on the same pill, and that's stupid because
Yeah.
we're different. So by giving people a smart wearable, men specifically a smart wearable,
Hmm.
they're getting data that is not drawn from a generalized data set. It's theirs, and men really
Yeah.
differ in terms of their response to the cock-killing impact of antihypertensives,
Hmm.
antidepressants, whether they respond to testosterone replacement therapy, whether the PD-5 medications that are overprescribed, Viagra, Cialis being the big ones,
Hmm.
whether they even work for them, or what's the right dose. But
Right.
getting back to your question, there are two sensors embedded in the tech rings, a pressure sensor here, a strain gauge on the hook. The device goes on differently in most cock rings. It doesn't slide down the shaft.
Okay.
Man drops his balls in
Okay.
like that.
Yep.
It wraps around and closes with a hook, sits like that. It's easy on, easy
Okay.
off. It can be worn overnight. It can be
Yeah.
worn during sex.
Okay.
And so what's the data? The data is a measure of how hard a man is, how long
Okay.
he lasts, and time. We are coming out with version 2.0 in Q3 this year, and
Okay.
we'll be adding two more sensors, one of which will actually give the girth of a man to a micromillimeter,
Okay.
and a accelerometer, and that allows
Very cool.
the gamification of sex. As in,
Yeah.
Stephanie, you are an incredibly woman. You are having sex in more positions than any other woman that we're aware of. Guys, or it could be, hey, Elliot, might be boring your wife. I mean, doggy style, night after night after night after night. But we laugh
Yeah.
at, we can do that. But on the medical side, it's really valuable. It could be,
Sure.
hey, Stephanie, your boyfriend's having problems. We think, what are his medications? Oh,
Yeah.
he didn't have a problem last month. What has changed with his medications? Or Elliot, it could be, since you started on pill X,
Yeah.
or testosterone, your erections are 10, 20% harder. You're lasting longer, having more nocturnals.
Yeah.
So we're really opening up the black box of taking the diagnosis and management of male
Hmm.
sexual problems from the world of conjecture and guessing and convention into individualized therapy. And we're building a similar device for women that will the world's first monitor the clitoral health that will come out with Q1 next year.
Wow. I'll
Yeah.
have you back to talk about that one because we need that as well.
You do, and here it is.
Yeah. Oh, very cool. That's exciting. So, when guys are wearing this, so nocturnal erections, they really get as hard while they're sleeping as they do during sex?
That's a great question because yes, no,
Okay.
but not every erection. So
Okay.
the average man, starting around age 25. Now, teenagers, there are male
The
teenagers
wind
are
blows. Yeah.
you got it, yes, yeah. But the average, starting in the late 20s and on, the
Hmm.
average man has 3 plus nocturnal erections per night, maybe 4.
Okay.
Um, now, some nights might have 5, some might have 3. I'm talking about what the average is.
Yeah.
And usually, 1, if not 2 of those erections are as hard as a sex erection.
Hmm.
First, I wasn't expecting that, but that's what
Yeah.
the data shows. So that's the way it is. And that's the great thing about this enormous data set. We're seeing things, two really important things that the doctors don't get yet, and they need to be educated. And I'll tell you what they are. Right?
Okay.
Come on.
Yeah. Tell me.
So the incidence of erectile dysfunction goes up 10% per decade after age 40.
Yeah.
So thinking of the doctors was, there's more erectile dysfunction, and also as men get more hypertension, diabetes gets worse, obesity, men have heart attacks, their atherosclerosis gets worse. The number of nocturnal erections will go down. And there's 3 plus, so 3. And the firmness of the sex erections would go down.
Oh, okay.
We're not seeing that. Now, obviously, if a man has a catastrophic health event, he's
Sure.
about, because our device can be predictive of a heart attack,
Yes.
among other things. But barring a catastrophic event, which doesn't happen to most people
Right.
don't have heart attacks. Most
Yeah.
people don't have prostate cancer. Most of these things will produce the type of deteriorations that the doctors were anticipating. But most men, even men with borderline hypertension or borderline atherosclerosis, they still get enough blood into the penis to stay hard. And it's not till they're in their 70s that starts to deteriorate, and not very much, just a little bit. So what's going on? What is going on the doctors don't understand? And it's so obvious that one thing that's hard in medicine and other areas of life is that when there's a problem and you've been taught there's a solution, and then there's another solution and it's really obvious, it's kind of hard to say, oh, fuck. How can we have missed that? We're doctors. How can we have missed that?
Right.
So I'll describe crudely how blood gets back and forth from the penis. Yeah, you got a pump, you got the heart. So the doc's thinking, okay, pumps, as you get older, the pump gets weaker. What can we do to make the pump stronger, make the heart healthier? And the second part is the arteries, the pipes that come out of the heart and put blood into the penis. And so, okay, we got to dilate them. And that's where the PD-5 medication, Viagra, Cialis, come into play. But bear in mind, most men don't have trouble getting blood into their penis. This is what the doctors don't wrap their minds around. Most men, now, 15% of men who have ED can't get it up. Well, those guys truly have dysfunction. And I think the word dysfunction be reserved for those men. If a man has trouble getting it up, the man needs to actually get our technology. He needs to get a tech ring and just see whether he has nocturnals or no nocturnals. If that man has 2, 3, 4 nocturnals, and nocturnals that are strong, PD-5 medications help a little bit putting blood in. But that man's problem is not getting blood in. On the other hand, if that man had 0, 1, or 2 weak nocturnal erections and he can't get it up, that guy needs a doctor. That man needs a cardiologist and urologist. He needs to work up to figure out what's going on with his heart, what's going on with his penis. But most men's problem is they get it up and they lose it. Why? Well, it's complicated and multifactorial. So if a man has good nocturnal erections, but in bed, between the sheets,
there we go.
I'll try to work that as often again.
Yeah, I like it when you plug that. That's great.
but they lose it.
Yeah.
Then it's the good nocturnals, so they get enough blood flow. What's going on? Well, PD-5 medication is not the solution. There's something going on the other side of the circulation, which is the venous return to the heart. And the doctors aren't thinking about this.
Yeah.
So every erection ends in blood leaving the penis. Now, it could leave the penis for lots of reasons. It could leave the penis faster because of medications. It could leave the penis faster because of alcohol. It could leave the penis faster because of drug abuse.
Yep.
It could leave the penis faster because the guy does have his diabetes or hypertension getting worse. But the most common reason why blood leaves the penis is because of the sympathetic nervous system, the fight-flight reaction. Yeah. And that could be anything. It could be a baby crying in the next room. It could be that the man is preoccupied by stress at work, or maybe he and his partner just had a fight. Or it could be one of the big things that men don't talk about that causes ED. And I really call this more, this isn't really dysfunction, this is more like disappointment or lack of fitness. 3 things that men complain about women that they don't talk about with women. Do you want to hear what they are?
Yep.
The first one is boredom. In a committed relationship, people often fall into the habit especially if the woman finds she gets off most easily in one position, it gets boring.
Yep.
I suffer from this as well too. I'm married 37 years in this May. Until I started using cock rings, there were certain positions that my wife likes that bore me. You want me? What does my wife like? And she doesn't mind. I talk graphically about this. And I think your audience needs to hear this. After my wife has a climax, she wants me to fuck her from behind. Well, that was kind of cool when I was 30, 35 years of age. Right now, I'm not. It's like, hey, we've done this 5,000 times,
Yeah.
and I'm going to lose my erection because
Yeah.
I'm not on board with it. Or
Yeah.
it could be I'll flip the other position, that missionary position.
Mm-hmm.
I don't get the friction there that I used to get.
Mm.
Why? My wife's had 3 babies. She's 70 years old. It's not
Yeah.
her fault. But
Right.
no guy is who has a brain is going to tell his wife or partner, your pussy's too loose and I'm bored.
Yeah.
That's kind of a buzzkill in bed. I don't. I
Yeah.
mean, yeah.
Not
So
even just in bed. I mean, I think you might just have relationship issues then.
yeah. But these are real issues. And now women
They
have
are.
the. And look, we could spend another hour talking about the complaints that women have about men, and I've heard them, and you've probably heard them too.
Yeah.
And the other one is distraction.
Mm-hmm.
So a common complaint that men have about many women in a committed relationship, not in the beginning of a relationship,
Yeah.
is women, even when they're turned on. My wife was one of these women, and she recently had her 2 sisters over, and they all turned out to be the same. Maybe it's genetic, but it's
Maybe.
something how you're really turned on. You can start talking about something else that's really important, like something that happened with the kids, something that happened at work. Oh, I didn't tell you that my mother fell down. She has an injury. No, just something else. Something else comes to mind. Now, granted, that's better than someone running the laundry list or the shopping list in their head. But
Right.
and previously, a few years ago, I would have gotten, for me, that would have been a what the fuck moment. You can't keep this thought to yourself. We're so turned
Right.
on. Cock ring changes all those things
Hmm.
because if a man can attain an erection and puts a ring on, a comfortable and effective ring, which not
Mm-hmm.
obviously want to push our ring, it's a maximum performance ring.
That's right.
Uh, I and I know from speaking to my customers and my patients, I'm going to be hard for 30, 40, 50 minutes with minimal
Mm-hmm.
stimulation. Now that's a game changer
Yeah.
because I don't, there used to be between my wife and I and many couples that I work with, this sort of rushed orgasm. Oh, we're
Mm-hmm.
both turned on. What vibrator? What position? Let's
Yeah.
rushed orgasm, if you will.
Right.
With a cock ring on, it totally changes things because
Mm-hmm.
it's relaxed. The man is more confident. That's a game
Mm-hmm.
changer. So
Yeah.
I'm and the woman's more confident, or
Sure.
even the male partner, because I've had gay guys say the same thing too in
Yeah.
a long-term relationship. They're more, if you know your partner is not going to stay turned on, total
Mm-hmm.
total game changer.
Yeah.
So I wasn't expecting, I got into this for the data,
Yeah.
but then discovered along the way that there's actually a mechanical solution. Blood leaves the penis, get an erection, put a ring on it,
Mm-hmm.
and enjoy the benefits of that. So
Yeah.
because what's a common thing between in a committed relationship that kills, aside from boredom and friction, those issues? It could be alcohol, or it could be,
Sure.
I'm tired. I experienced in my relationship as well too. I'm tired.
Yeah.
She really wants to make love. It's a confidence issue. But I
Yeah.
know that, even though I'm tired, if I had 3 drinks, okay, game on. Because once I get hard, I ain't going to lose it because of the ring.
Yeah. Oh, it's fantastic. So, because when have recommended cock rings previously to learning about your product, they are the tighter bands and they should really only be worn for about 20-ish minutes.
Especially
And
if
so
you have
you're
diabetes.
saying, right.
Yeah.
And I even had a patient who could not get his off because it was so tight and ended up with bruising and couldn't get erections for several months while everything was healing and stuff. So I love that yours have the hook. First of all, so much easier to get on and
Safety.
off. And second of all, I love that the material isn't so tight and restricting that you're limited on how quickly you need to get it off.
Well, these other O-rings they're like a noose on the dick. So because
Yeah.
they're cutting off the arterial flow, for them to be really effective, a man has to be completely hard, and then he puts the ring on.
Mm-hmm.
Because we want to count nocturnal erections, our rings allow the arterial blood to flow in and only constrain the venous return. It's kind of like a plug on a sink that's covering
Yeah.
it 75, 80%. And if most men, if you're
Yeah.
bigger than that, no one wants to have sex with you. So
Nope. Tap out. I
So
always laugh when the guys come in and they were like, "Oh, I wish, I'm so sorry you have to examine me. I'm not that big or whatever." And I'm like, "Trust me, if you were real big, I wouldn't want anywhere near you,
well,
professionally and personally."
yeah, well, those guys are actually in a sad situation. I'd say,
They were.
I was thinking about it, but I open up my schedule 5 hours a week to speak to customers
Hmm.
and patients, and it's 'cause I want to know how they're using the material and how we can make it
Yeah.
better, how we can make the
Oh, I
data more
love that. What a
accessible.
great way to stay engaged.
And, I'd say once a month I get a guy who's really big. And
Yeah.
hey, if your girth, erect is more than 6 inches, you're lonely.
Yeah.
You might have had some fun in high school or college because you're a novelty,
Yeah.
but afterwards, no woman or man for that matter wants to be in a relationship with a guy who's, you know,
Yeah.
6
Oh,
inches in girth.
absolutely. It's just not fun or
Well,
comfortable.
let me make
And
another
same with
point.
length too. I mean, if the length is too much, you're having to hold yourself back and not be able to just bury in
Plus,
or whatever. So, yeah, I always giggle at the guys who want to be the bigger and better form, and I'm like, trust me, we're good. Average is fantastic.
yeah, and fortunately, most people are average. The bell curve is really narrow.
Yeah.
And yes, black men, some from certain regions of Africa and other regions of
Yep.
Africa, are a little bigger, but half an inch, 3/4 inches. Ultimately, I don't think women care, or men care for that much once they get over their early 20s.
Yeah.
The novelty, I think of it. But another thing we
Yeah.
discovered with cock rings,
Hmm.
this one specifically, the maximum performance ring, I designed it to for two purposes. One, so that men can have longer sex sessions safely and
Hmm.
comfortably. And we say 90 minutes. I've wanted for 4 to 6 hours. We
Okay.
met the 90 minutes is just something we said for medical legal reasons.
Hmm.
We're confident they can be worn for a long time.
Okay.
But I also designed it to intensify a man's pleasure. Women have vibrators and men have shit.
Yeah. Yeah.
And in my lifetime, I'm a lot older than you. Looking at you, I'm probably twice your age. Maybe more.
Not
Yeah.
quite. But
But
thank you.
um, my mother's vibrator in the late 50s, early 60s was hidden away in the bottom dresser drawer and supply closet in the garage.
Yeah.
Uh, when vibrators started to become more mainstream in the 80s and the early 90s, there's still a certain shame for women. Oh, you got to come with penetrative sex. You're getting vibrator addicted.
Right.
And now it's like, wow, they're mainstream. I mean, I don't know how my wife owns, and I certainly, she, depending upon what her mood is, what the position
Yeah.
is, and it's great. She's got all sorts of toys to play with. Women have all sorts of toys to play with.
Yeah.
My daughter takes them on dates. Men have
Yeah.
shit. With
Yes.
nothing.
Right.
So
And you can get them anywhere now. Amazon, Target, anywhere. I mean, if you want really good ones, you go to the better places, but you can get one for $20 at Target right now.
yeah, no one would say to a woman today, no, you shouldn't do that. You
Right.
should. I mean, it's some of the stuff that gets told to guys, especially now it's really popular among therapists and doctors. Is men are porn addicted and they put to get this death grip on their dick. Well, it's not a death grip.
Yeah.
I certainly. And by the way, to any men out there, you want to marry someone who's better with their hand than your hand. That's another important piece of
Little
advice.
tidbit.
But but this has a hand has a brain attached to it and can vary in sensation. A vagina doesn't. And to some degree, the emphasis on penetrative sex for men and the de-emphasis for women on penetrative sex is sort of this disconnect. So we're going to encourage women, hey, whatever way you want to come, put that vibrator, dildo, wherever you want, do whatever you want. That's great. And somehow back to men is you got to avoid the death grip. What?
Yeah.
I was with a group of women. We're talking about this, doctors mostly, and
Mhm.
the death grip and these trainer devices to train men to just come to vaginal sex. And I said, well, what about, okay, ladies, how about if vibrators only came with low speed?
Oh my God.
You know, so look,
No, thank you.
I enjoy penetrative sex, but I know from talking
Yeah.
to my patients and my customers, and you probably know this as well too, for older couples, and I mean older, I mean the 40s and 50s, penetrative sex is not how they're coming.
Right.
And it's that's often actually a cause of ED. And I'm going to tell you about a patient of mine
Yeah.
from about a month ago. He became a customer, but he was a patient initially.
Hmm.
Guy's in his 60s. He's probably spent $16,000 on his ED, which he didn't
Yeah.
really have. I'll explain why in a moment. He had the conventional PD5 medications, testosterone replacement therapy, shockwave therapy,
Hmm.
then the alternative stuff: red light therapy, cold laser therapy,
Yeah.
hot and cold plunges. And I asked him, well, let's talk about your ED because
Hmm.
can you attain erection? He said, yeah, no problem attaining erection. So the problem is sustaining erection. When do you lose your erection? And it told me something that I've heard from other men and other women too, because women have this in their head as well too.
Hmm.
Well, I go down to I get hard, we make
Hmm.
out, I go down to my wife, I lose my erection largely. And then she wants me to penetrate her, and I get it up again, but then I lose it.
Mm-hmm.
So, well, that's not ED. You need to
Yeah.
put a ring on it. Because, let me see. A guess. So your wife, how many kids she have? She had 5 kids. How old's your wife? 62. You're just not. You feel any friction when you're having sex? Yeah, she only likes the missionary position, and I don't feel anything.
Mm-hmm.
Well, so he bought for $60. He bought a maximum performance ring.
Yeah.
And last week he told me, well, 3 nights in a row, I kept it hard. Actually managed to come in it once.
Yeah.
And it was so, the doctors never asked him the question
Right.
that the obvious question, which is, when do you lose your erection? They just threw him into the ED category, and he ended up spending a lot of money.
Yeah, it's interesting being on this podcast. I've had some really fantastic guests, yourself included, that have really helped me kind of change the way I ask questions about ED for my patients. It's not just, do you have erectile dysfunction? Okay, here's your Cialis or Viagra. It's, do you have it with masturbation? Do you lose it with intercourse? When do you lose it? Are you losing it when you're changing positions, or when something like you've said comes into your mind and you get distracted? Do you lose it with your girlfriend and your wife, or just one or the other? I have patients who have group sessions and they need to last longer in those sessions and things like that. And so it's really helped me kind of hone in on the questions I ask, and not to forget to ask about the orgasm itself, because a lot of my guys have issues with delayed orgasm. And so they just give up on achieving it because their wife taps out, or
Right.
whoever their partner is taps out prior to them being done, or the only way they can achieve orgasm is through masturbation for the same reason. So that it's really changed my way of talking to my guys about this.
Well, I've helped some people. These aren't customers. These are actually patients. But I help a few people by saying, okay, when your wife is done, and usually using a vibrator with penetration in some position,
Yeah.
she's cut. You need to tell her to use her hand, because that's because that's what you're going to get off on, as opposed to you rolling over on your back. You're grumpy. She doesn't even know what's going on.
Yep.
Anyway, I want to make another point about this ring. It was designed as well to draw out the ejaculatory phase.
Okay.
So by increasing the ejaculatory phase, we produce a more intense male orgasm.
Okay.
Visually, in comparison to my wife's orgasms, I don't think it's as good as hers, but it's a lot better than what it was before. Now, a couple of years ago, and it wasn't, I don't have ED. And for me, probably for like a lot of probably for you too, cock rings were a novelty. Yeah, you go to sex toy stores, you see them online. Matter of fact, most of the cock rings that came to me were like, my wife's buying herself yet another vibrator.
Yeah.
And because it's like the color, or likes the ergonomics or whatever.
Yeah. Slightly different change. Yeah.
Right. And then of course, it's like a pity toy. Hey, we'll get you this, we'll get you one of these, Elliot.
Yeah.
Well, what'd you pay for yours? $145. What'd you pay for this? $9.95.
Yeah.
But they didn't enhance my pleasure. They could keep me hard, but I don't. My problem is not getting hard. I would like more intense pleasure. So I designed this ring to put the right amount of pressure over the urethra to increase the ejaculatory phase up to 50% in a man. Well, that's a dynamite orgasm. The longer the ejaculatory phase, the more intense the pleasure. And this is our number one seller is the maximum performance ring, and largely for that feature. But also, it's also as effective as tennis Cialis. That's nice. It's a non-pharmacological solution, because most men's problem is on the venous side, not on the arterial side. But both together are the best of all.
Yeah.
So the real takeaway for men is, if you want to have something that approaches a vibrator for a woman, put a ring on it, of course, and take Cialis or Viagra. It doesn't like Tadalafil or Sildenafil.
Yeah. Yeah. No, that's fantastic. So for guys with premature ejaculation, this would help them possibly last longer as well?
And we have men who buying it for that purpose. Often premature ejaculation is early on in a relationship. And part of that is actually, it's a form of ED to my mind, probably yours as well too, because they're so worried about not coming, they want to come as quickly as possible. They just want to come as quickly as possible. And but if a guy can keep thrusting comfortably, because the problem with these rings is that once you come, you want it off. It's uncomfortable. This ring is comfortable. You can keep it on 4 or 5 minutes, and say hard 4 or 5 minutes after climaxing. And I'm old. I've twice in the last year with my wife, come twice with this in an hour and a half. That's took me
That's
aback. She was
amazing.
surprised too. But we have
Yeah.
young guys who are using it in their 30s who see it as a multi-climax tool as well.
Very cool. Very cool. So the one that you're showing right now is the one that does not have the technology.
There's not technology,
So
correct?
it's cheaper.
Yes.
So if you need to buy in without, try it before you buy it like too much, this is the cheaper option, but you're not going to get that information to your phone about your nocturnal
Correct.
erections and the firmness and all of that.
And of course, getting back to what you're talking about for with your boyfriend at the beginning of the conversation, should a woman date a man whose erectile fitness score is less than 6 or 6.5? I think the future of this is gamification. The future of this is going to be on people's dating apps. I mean,
Yeah.
the guy might drive a Porsche and make $1 million a year, but you don't want to get involved with someone whose erectile fitness score is less than 6.5.
Sure.
Unless, of course, if sex is not important to you and you want to, that's different. But if sex is important to you, and it's going to be an issue for that man as well too. I mean, guys who have guys who can't get it up or lose it quickly,
Mm-hmm.
they've got major psychological problems. Just the way their female women who have similar problems have problems as well too.
Yeah. And I think, going back to the start of the discussion with how connected erectile function is with cardiovascular function. I mean,
Yes.
that took me by surprise when I got into urology because when you're not in it and you're not learning the science behind it, you really just think, oh, he's not turned on enough or he just lost his ability to have erections. You don't really understand how significant of a predictor that is to your cardiovascular health. And it's such a great thing. So I love that the one with the technology, the tech ring has that ability to help us understand better. Because really, other than that, we've had penile Dopplers, which is such a snapshot in the penis health.
Well, look. One thing, I know 2 men who've used our device who got cardiac catheterizations as a result of their data.
Wow.
Now, was it life saving? No, they probably would survive the eventual heart attack eventually anyway. But our device can, to your point, make problems to the heart or medications overt before they become when they're still covert and invisible. And that is why I got involved in this. But it's important, I think, for men over the age of 45, 50 to know the vital signs of their sexual health. I think that what we're doing will become a standard for care. I mean, we don't go to the doctor for a physical and not get a blood pressure, electrocardiogram, low proteins. Guys got to get over their inhibitions about rings for the data, because the data is potentially life changing, if not life saving. Yeah, and for women as well, for the partners as well too. I mean, we've had women who are often more appropriately more concerned about the guy's health or more active about their man's health than the men are. I'm certain this is true with your patients. Yeah, and it's often the woman who insists the guy see the urologist with whatever the problem is. And a doctor in the office, to your point, I mean, I've had one done to me just so I want to see what it would feel like. Well, the guy had really big hands and hair on the back of his knuckles and gloves and, puts that cold jelly on you, comes out with a metal probe. That's not telling me anything about my sexual health. Now, I don't have ED, so we didn't inject with Trimix. Of course, always learning this, does it work or not. But I'm vasoconstricted. He's not going to learn anything about. Yes, he will be able to see whether there's some blood flow or whether there's some whether there's significant venous leakage, but he's not really learning about what's going on and privacy. Our device is in privacy at home under real life circumstances.
Yeah, I love that about this device. And I think, even the price point on the tech device is still reasonable. Now, are your devices, are they able to be bought with FSA and HSA accounts?
Yeah, we are.
That's awesome.
HSA approved. And because of all the research, we will soon, our government moves slowly. We will have right now we're what's called a 510K waived medical device, which means we can claim that we're a consumer wellness aid. We can't say we're a diagnostic or a diagnostic aid, but we are.
Yeah.
By the way, I hope the FDA is not listening to me when I said that.
Let's put an asterisk by that quote.
But so we've applied for full cover. Our lawyers say it'll be Q3. It might be Q4 this year. We'll have it, and then it's another 6 months to get insurance coverage, Medicare, Medicaid, the Blues to pay for it. In a better world, they would come to me and say, "Hey, You guys have the world's largest data set. How can we help you? How can we get this information out to the
Right.
Zwonitzers of the world and all these urologists around the country about using
Yeah.
because they're doing a disservice to the patients right now,
Right.
in my opinion. They are prescribing medications, therapies, even sometimes surgeries. We had 2 guys who were going to get implants who got a technology. It's like, my dick works.
Yeah.
I know one of these guys actually later went on to get it, but he's one of those guys who wanted to have the big schlong. He
Yeah.
just, but he was surprised that he actually thought his penis didn't work, and his penis
Yeah.
worked at night.
That's so interesting. And I love it too for post-prostatectomy guys and watching the recovery that can happen after surgery.
This was a surprise to me because Stephanie, I'm not a urologist. I'm an
Mhm.
emergency medicine doctor by background, and I have a small concierge practice as well. And I wasn't thinking, when Dr. Hotaling, who's my chief medical officer at the University of Utah, approached me with this, I wasn't thinking about prostate disease. Frankly, not that it was he. But then men with status post prostate surgeries started buying our device, and they formed a chat room. And
Okay.
then they contacted me. Like there were 5 people in the room talking about how valuable this was to them because they could see where they were. And some of these men they had nocturnals, but they're afraid to resume sex, so they thought they might fail.
Yeah.
Well, it's big when a guy sees it. Well, like, wait a second, I got 5 nocturnal erections. It's here. It's
Yeah.
in my head. I need to do something. Do something about this. Or it could be that I stopped taking the therapy because the therapy is not working. You deal with these men.
Yeah.
I'm 18 months out from the surgery and nothing's happening. Nothing's working. I've been all these. I've been to 5 doctors and no one has an answer. No, and then I got nocturnals. Maybe I
Yeah.
should resume pumping. Maybe I should take the Dalafil. Maybe I should, et cetera, et cetera.
Yeah.
So it's a
Absolutely.
valuable tool. And there are 2. Dr. John Mulhall, who's the chief head of andrology at Memorial Sloan Kettering, is about to kick off a prostate paper, prospective, prostate paper.
Mhm.
And in Spain, Javier Otero, who's the incoming president of the European Society of Sexual Medicine, he's also going to be doing a prostate paper. I think it'll take 2 years, 2-3 years, but this will
Yeah.
become a standard for prostate care.
Yeah, I think so too, because it's really part of, penile rehab is such a big deal post prostatectomy, and even ADT patients that didn't have their prostate removed but are being stripped of their testosterone for 6 months to 3 years or even longer. If you don't use it, you lose it is true with the penis, and so we need to know where it's at, and we need to help encourage these guys that hey, it's coming back, or you're getting there, and I just that to me is so exciting with this because of how many prostate cancer patients I see every day.
They also, when they're out about 8 to 14 months, they start getting chubbies. They start getting,
Mhm.
smaller. Well, the ring, the and here not the tech ring. We
Yeah.
recommend the maximum performance ring,
Uh-huh.
the one that's tighter. The ring will allow them to resume relations. Now they might be a little bit retracted, as you know better than I do.
Yep.
They might be they're on the if they have a tech ring, they might be at
Mhm.
they're not at 8 or 9. They're at
Yeah.
they might be at a 5 or a 6. But the ring will keep them there and allow them to either masturbate,
Mhm.
have oral sex, receive oral sex,
Yep.
or to penetrate a bit and have that intimacy that their partners are craving, physical intimacy.
Yeah, absolutely. Absolutely. It's such a great thing. And it's just so exciting to me that there's so much progress in sexual medicine innovation and that we are really making strides to help our patients, continue their sex lives later in life. I mean, we're making progress on menopause and getting women able to keep their libido and things like that. And so they're actually interested in still having sex. And
Yes.
so, keeping the guys able to have sex as well, it's so paramount to our physical health, our mental health, our relationship health. I'm just super excited about the future of sexual medicine.
Plus, you can actually, because the data is personal,
Mhm.
you can individualize. I mean, you can actually examine some of the big alternative therapies. So shockwave therapy.
Yeah.
Well, we have guys buying our device before they spend $1,000 on shockwave therapy
Mhm.
because, hey, if you got 3 nocturnals at night, you don't have vasculogenic ED,
Yeah.
and you're probably not going to just no point spending the money. It might have placebo effect,
Sure.
but it's not going to work.
Yeah.
Similarly, if at the other end of it, if a guy has 0 uh, nocturnal erections, his vascular disease or whatever is causing his ED
Mhm.
it's not going to benefit.
Yeah.
from
Too far. Yep.
And then there's tea, which is so popular with men today.
Mm-hmm.
So I went to, I won't mention names. Like a lot of doctors, I don't go to doctors to take care of myself.
Right.
I mean, maybe it's a little bit too arrogance about that, but here I am. I'm 70 years old. I'm in good health.
Yeah.
But because I'm interested in this field, I went back to an internist and to a community urologist here who has an academic background, because I want to see what other people experience when they go to the doctor. I told them, hey, I told them both, look, I like my sexuality where it is, but I don't want to lose it.
Yeah.
So I'm interested in taking testosterone. And they both got me on testosterone. And both of them are targeting a number and subjective factors. So one, do you have more energy? Are you sleeping better? Because if they ask about my sex life, I'd say, well, I can have sex every day. So that's not a good question with me.
Yeah.
Well, even that's subjective. Because what kind of sex you're having and how large your penis. But do I have more energy? How do you sleep? Well, energy and sleep those are subjective. I mean, Stephanie, if you right now would write me a check for $1 million, I'm going to sleep really well tonight.
Yes.
And I'm going to wake up tomorrow with a lot of energy. And I suspect the same thing would happen if I wrote you a check for $1 million.
Yeah, 100%.
So I want to make things objective. I want to look at things that I recognize sex is subjective.
Yeah.
And I can joke with my wife as well, too. Hey, I might only be able to really struggle to come twice in a day with you. But if the goddess Aphrodite shows up, I'm gone.
All bets are off.
But that's just, but I want to make things objective. Yeah. Both these doctors target the number 600, my testosterone.
Yep.
What's, from my perspective, dumb.
Yeah.
One thing, they get the quarterly visit, they get the quarterly blood test, they get the quarterly telehealth follow-up. I don't care. Hey, maybe my number should be 1,000, or maybe I'm just as good at 400. So what are my goals with testosterone? I'm not taking testosterone I have many customers are doing it. I'm not taking testosterone for my dick. I'm taking it for my muscle.
Right.
I'm 72 years old soon. I don't want to lose muscle mass. Matter of fact, I'd like to gain a little bit.
Yeah.
And I was surprised. Just taking testosterone alone and not changing my exercise regimen, my upper body strength increased by 8 to 10%.
Wow.
And that was impressive. Now, testosterone on the female side, do you prescribe testosterone to women?
I don't prescribe it to women. I do prescribe it to men, but I'm learning about the women's side of it. It's just not there. I'm not there yet.
It's amazing. Yeah. Well, because I'm on the concierge side. You're probably not on the concierge side.
Yeah. We do insurance.
So I can, I don't. What are women's concerns about testosterone therapy? Maximalization. Hair,
yeah,
pimples. Believe me, you don't wake up with a Hitler mustache overnight. These things are dose related.
Right.
And frankly, if a woman's in her 60s or 70s, facial hair is normal. So it's even hard to see whether it's testosterone Anyway, I prescribe it now to 12 women.
Okay.
And over the age of the youngest one's 55. The effects are dramatic in terms of libido.
Yeah.
What I hear from them, and none of this is off the subject about what we're talking about, but it's interesting. But what I hear from these older women is they feel like they're in their 30s again. They look at their husband, they think he's sexy coming out of the shower. The mindset has gone from, if I get turned on, I might want to have an orgasm, to I want it. Yeah. And not I want it like you did when they were 20 years old, but they want to have an orgasm several times a week as opposed to a couple times a month.
Yeah.
And that changes the relationship completely between 100%. Men and as women. I think that testosterone replacement therapy will be the norm for women in 3 to 5 years.
Yeah, I agree with you. I'm really excited about it. I've listened to other people talk about it. I just don't have experience prescribing it myself, but I think it's amazing what it can do. And it's such a low dose for women. We're not getting these big doses. You are not going to look like the bodybuilder, things like that. You're just getting enough back to enhance your life a little bit.
Well, most of the women, if they're on the right dose to increase the libido, this is my limited experience. This is anecdotal. I haven't, not a study. They get a little bit of clitoromegaly, but that's not a bug. That's a feature. And it's not like they have to buy men's underwear, but they their point to me is, I have the clitoris now that I have when I was 25 or 30 in terms of size.
Yeah.
And what happens to the clitoris without testosterone? Women go through menopause, atrophy.
Yep.
And so it's actually, I'm going to guess it's going to be like HRT. The sooner it started, the better.
Yeah.
HRT meaning estrogen.
Yeah,
Let's just
absolutely.
talk for a moment about the male refractory period.
Okay.
You have a moment?
Yeah, go for it.
So the male refractory period is the time between orgasms.
Yep.
This is the male menopause.
Mm,
This is the real andropause in men, and it starts before women have menopause,
yeah.
but no one talks about it. There isn't a single study of the the male refractory period.
Really?
There's some rat papers about about prolactin shit,
Yeah.
but there's not a single paper. There's
That's
some anecdotal stuff
surprising.
about the failure of testosterone.
Huh.
So think about that. Here we have, I mean, men complain that women want a victim. The women were the victims. I'll give you another example. At this device, even
Mhm.
among doctors and sexologists we're at shows,
Mhm.
women urologists, sexologists tell me, "Oh, not another thing for men." It's like, what are you talking about? Go into any sex toy store. Where's the men's stuff? I mean, you go to a
One
sex
little
toy store.
corner.
Yeah, it's back there. And the women and the 25-year-old woman with purple hair and 2 rings in her nose who's selling this
Right.
stuff, she has lots of opinions about vibrators and dildos. She has
Yeah.
no opinions about the stuff that's back there
Right.
for the guys.
Right.
So we have the male refractory period. There's nothing,
Yeah.
and we don't know what causes it. And I've spoken to Mohit Karan at Baylor about it, John Mohl, big shot urologists.
Yeah.
They're not even thinking about it.
Yeah. It's just something we just accept, right? That
Exactly.
when you're in your 20s, you can have sex 3-4 times that night, orgasm every time.
Right.
But by the time you're late 30s, early 40s,
It's
maybe
half.
once a day.
Yeah, it's half. And then by the time you're 70 or 80, well, this is where it's important to my mind for men to recognize it is use it or lose it.
Yeah.
And if you can't go to the gym and exercise just the smooth muscle in your penis
Yeah.
any more than you go to the gym and exercise smooth muscle in your intestines, you have to use it or lose it. So I believe, and just an N of one, that the reason why I am able to have sex every day comfortably is because I've made a habit of it and just
Mm.
wouldn't let go of it.
Yeah.
Because when I was, I think it goes down almost like 50% per decade. When I was 20, I could come 6 times a day, and then by 30 it was like, kind of 4.
Yeah.
And by 40 it was like 2 or 3. Now, I'm excluding the Aphrodite showing up scenario.
Right.
And then when you're 60, it's like 1. And then that's
Yeah.
kind of been where I've been since, really since my late 50s and 60s. That's where I've been.
Yeah.
And I can push it. The ring does help, but
Yeah.
I'm not inclined to push it because it's uncomfortable.
Yeah.
And that's one. Well, the obvious point is that the clitoris is obviously superior to the penis as an organ of sexual pleasure.
Yeah.
Obviously.
Yeah.
But the fact that it hasn't been studied,
It's very
or the
interesting. I
fact that
hadn't
men aren't
realized
being
that.
the fact that men aren't being encouraged to either have sex or masturbate in order to maintain their sexual health, that's wrong.
It is.
And just the way we should be encouraging couples
Mm-hmm.
to have more sex, we should be encouraging men and women to masturbate if
Yep.
you know a partner, because it is use it or lose it.
It is. And it's for health too. I mean, there's a study that came out recently that said men who orgasm 21 times in a month have a 20% reduction in prostate cancer than men who only orgasm 7 times a month.
Well, there's a study out of the UK, big one, had like 60,000 men in it. They tried to control for a lot of cardiovascular risk factors. Men over the age of 70 who had sex twice a month versus, twice a week versus
Mhm.
twice a month or less, cut their cardiac risk of death, NMI, by 50% for the next
Wow.
decade. That's huge. Now,
That is huge.
and
Yeah.
here's another thing. I'm good friends with the governor of Montana. Where are you located, Stephanie?
I'm in Maryland.
Maryland. Try this, and I'm going out on the Commission of Health in Maryland.
Okay.
Everyone's very concerned about the family or
Mhm.
committed couples not separating
Yeah.
because of the impact upon the children.
Mhm.
Children of separated parents have higher crime rates, higher drug rates, less likely to finish school, make less money.
Yeah.
Why are we? So we know that from large studies as well that couples in committed relationships that have sex twice a week
Mhm.
versus 2 times less a month have half the separation rate.
Yeah.
So here's something. This doesn't require any expenditure of government money, no controversial AID or NIH grants. Why don't some commissioner of health come out and say, governors say, look, I want people here in Montana or Maryland, we want you to have more sex.
Yeah.
We want you to have sex several times a week because the family, and we're going to save money in the schools and the prisons, but no one's ever going to do that. It's kind of peculiar. I mean, that's not peculiar. It's wrong.
It is wrong, but it's such our society, isn't it? You go eat fast food versus go get something healthy and organic. Go park as close as you can to the store instead of getting the extra steps and the extra exercise. Take the elevator instead of the stairs. It's what we do. It's what we're taught and what is promoted in every aspect of our life. And it's the same with sex. Sex isn't talked about as a measure of health or a measure of keeping your relationship healthy. It's just about pleasure in society. And it's so much more than that.
Yes.
Yeah.
And I just have to think about how cranky I can get if I don't have an orgasm for 2 or 3 days.
Oh, absolutely. Absolutely.
And for my wife, it's about 5 or 6 days. So it's not that much different, frankly.
Yeah, absolutely. No, this has been a phenomenal discussion. I thank you so much for being on here. Our time has flown by, but I am so excited about both of these products and getting my patients to use them, getting the listeners to use them. I am going to report back to you with my boyfriend's number and make sure that we're in that 6 or more percent. So that we can get that. But just to let the listeners know, in the show notes, we will put a link to the FirmTech website, and they have generously given me a code to give you guys a percentage off on that. So we'll have that in the show notes. Thank you so much for being here today and all of this amazing education.
It was a pleasure. I'd like to close with, you now can harness technology to enjoy a longer life of lovemaking. So put a ring on it.
Put a ring on it. Put a ring on it and get between the sheets.
Yes.
There, we'll plug both of us. All right, everybody. Thanks for listening, and we'll see you next time on Between the Sheets. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics between the sheets.